Welcome, everyone. Welcome, welcome. Okay, let me get situated. Did it pop up? Refresh it. Yeah. All right. Welcome, everyone, to the Care by Christie Facebook page. I'm Christie Freeze. I'm the founder of Care by Christie, which stands for Creating a Roadmap for Elder Care. If you're new here, if you're not new here, you know that the beginning of the year, I did a 12-week series called Resources Within Reach, and I did it virtually. And today we're doing it in real life. I get that. She's really here. It's amazing. So today I have Ruth, who is with Storen Financial and specializes in Medicare and is going to give us a broad kind of high level overview. I have some questions prepared and we're just going to get to know you a little bit better today. So real quick, I want you to introduce yourself to everyone and then we'll get started after that.
My name is Ruth Hoffman and I am the Medicare Benefits Specialist at Storen Financial. And my journey in my career has been primarily in the individual health market, both for individuals younger than 65 and older than 65. And in the last 15 years, my primary focus has been for individuals that are coming on to Medicare, whether they are 65 and older or younger than 65 and coming on to Medicare due to a disability. So that's my area of strength, and I'm here with Christie to talk about Medicare and answer your questions if you have any.
Yay! So exciting. Thank you so much for your time and for doing this with me. I'm just so thrilled to be in person. Move this just a little because you can see our computer screen a little bit. And so for those of you that are tuning in, I do hope that you're telling us where you're tuning in from and what questions you have. This recording will also live on YouTube. It will also live here on the Facebook page, and then you'll also be able to catch the replay wherever you listen to your favorite podcast. So I'll be sure to share the links for those, and we'll get all of the Storen contact information and Ruth's contact information in the comments for you as well. So, you ready to get started with the most basic of questions?
Sure.
What is Medicare?
Well, Medicare is the health benefit program that the U.S. government offers to individuals that age into Medicare. Either you turn age 65, you've worked 40 quarters, you've contributed to that by paying your taxes and your employer has paid into that. And Medicare is for health benefits. You have the Part A, which is for hospitalization, for rehabilitation in a long-term care setting. It also provides hospice under the Part A. And then the Part B is the benefit for any outpatient services that you're going to have. So like walking in and out of your doctor's office, going to an emergency room, physical therapy, that's what falls under the Part B. So original Medicare is really just two parts, the A and the B.
Okay, yeah, that was one of my big questions. And we were kind of chatting before we hopped on. I know that there's a ton that were in the Resources Within Reach series that provide therapies. So for example, the Memory Compass, she is a Medicare
Medicare. She's a provider in the Medicare system for her therapies. And it could be not only physical and occupational therapies, but it could be mental health.
Yeah.
So I want folks to understand that if you're struggling, we're in this whole environment where we just went through this COVID situation and people are feeling isolated and struggling. Don't hesitate to see your primary care doctor. And if you're in need of support on the mental health side, there are benefits through the Part B of Medicare for mental health.
Oh, I love that. That's my favorite portion now of Medicare. I've decided Medicare Part B is all I care about. I'm just kidding. So that was one of my questions, is if it covered the therapies, the A and the B. And then you shared with me that there's also a C and a D. Is there also a supplement in addition to that?
Yeah, so original Medicare is really the two components, the A and the B. And then if you wanted to add, or you should add, prescription drug coverage, then that falls under the Part D category. And that's a policy that you add to original Medicare so that when you go to your local pharmacy, you can get your prescriptions covered.
I see.
And then the Part C, which Medicare calls a Medicare Advantage plan. Those are Medicare replacement policies. So when you enroll in a Medicare Advantage plan, you're basically communicating to Medicare that you're going to allow a private insurance company to handle your benefits under the A, the B, and then those Advantage plans also include prescription drug coverage, so it also delivers the D. And then some of the things that the Advantage plans bring to the table that are attractive to beneficiaries is that those plans also provide sometimes vision, dental, you get a fitness membership. There's additional things that you get that you don't normally get with just traditional original Medicare A and B only.
Okay, that is so helpful. That's helpful for me. That is like so crystal clear. Thank you for
You're
that.
welcome.
All right, so when should someone apply for Medicare? And while you're saying the answer, I just want to make sure we're good here.
Sure. Well, typically, if you are drawing Social Security or railroads benefits, you're typically going to get your card 3 months prior to that 65th birthday.
Okay.
So if you are drawing early and you're getting a monthly Social Security check or a railroad benefit check, then that is going to come automatically. If you are not currently drawing benefits through either of those programs and you're soon to turn 65 and you do not have health coverage like through an employer or a spouse, then you need to reach out to Social Security and let them know that you want to enroll in Medicare Part A and Part B. So Social Security is the branch that's going to communicate to Medicare that you're making a request for enrollment. And there's several ways that you can do that with Social Security. You can visit their local offices if they're now open, past the COVID situation. You can go online and under ssa.gov, like samapple.gov, they have a portal there where you create your own unique username and password. There's a lot of great information there. It's going to have information about your past earnings. And you can register there to enroll in Medicare. Just because you go to socialsecurity.gov and make an enrollment for Medicare does not mean that you're requesting Social Security benefits. Those are two different things. So if you're wanting to delay drawing your Social Security till later time past 65, you're not going to get yourself in trouble by going to socialsecurity.gov and applying for Medicare. That's really the way to do it. The other way that you can do it, the last way is, of course, picking up a phone and calling Social Security and making a phone call to a customer service rep, and they can assist you with that as well.
Awesome. And we'll be sure to drop that website in the comments for you, and really everything that Ruth is sharing. I'm going to go back through and make sure that you have all of this information and can access that easily. So thank you for that. And then you may have, I don't know if you've answered this already, but the initial enrollment period for the Part B, and then when does that become effective?
Okay, the initial enrollment for Part B is typically 3 months prior to your 65th birthday, the month of your birthday, and 3 months after. So you have 7 months in which to make a request from Social Security to enroll in Medicare Part B. Okay. A is automatic. It happens at age 65. Again, if you're not drawing Social Security or railroads benefits, then Medicare is not going to know that you're in need of the enrollment.
I see.
Okay. So if you're in need of the enrollment and you are not drawing Social Security, then you need to reach out to Social Security 3 months before, the month of, or 3 months after, to get the enrollment for Medicare Part A and Part B in place. And it will become effective the month of your 65th birthday or thereafter, the 3 months after. If you miss that window.
That's my next question. What if you don't?
Okay, if you miss that window, then you're going to go into what's called the general enrollment period. Okay, so what that means is that you will have to wait until January 1st to March the 31st to make a request from Social Security to enroll in Medicare, and it will not become effective until July 1st of that coming year. So it's really important that you time this properly, because if you don't, then you may be without benefits until you can apply during the general enrollment period, and it does not start till July 1st.
Wow.
And that could be costly, because let's say, for example, you don't put the Part B in place during your initial enrollment period, you miss that window. And now, let's say you're into February of the following year and you've got to go to an emergency room or a doctor's office visit, you're paying full retail. You're not getting the benefit of the Medicare approved amounts, which is huge.
Yeah, that's a huge amount of savings.
Yes.
It's potentially there. So it's really important too, and we talked about this right before hopping on, how even if you are in your 40s or your 50s or early into your 60s, knowing this information is really going to set you up for success. And I talk a lot about being proactive versus reactive. So you do not want to be in a situation, it sounds like, where you are 7 months after your birthday or even 4 months after your birthday, and then you're like, oh, I should have done that. So we're really trying to make sure that you have this information and you know what to do and you know how to do it, so that it is smooth, simple, and easy, and that you get the benefits that you deserve.
And honestly, you know, there's no shame in feeling overwhelmed with this information. Okay. This is so different from what you have under an employer program. And sometimes we feel inadequate even when we're highly skilled in the profession that maybe we're exiting.
I feel overwhelmed in employer healthcare insurance information. So this is like, yeah, don't feel like it's not something that you can navigate.
And there are folks like myself, we're specialists in this field, and if you feel that you need to consult with one of us, please do so. This is what we do for a living. And typically the way that we are compensated, I know sometimes folks want to know, well, what does it cost to sit with Ruth and do a deep dive? There is no cost for the meeting, because the way that we are compensated is that the companies that we represent pay us for the enrollments that we make.
I see.
Okay, so that it's never too early. I've started with folks like at age 60, where we're having a dialogue, you know, we're talking about things so that they can feel like they're getting their feet in the water.
Totally.
You know, and getting comfortable with knowing what's going to be coming, you know, down the pipe.
And then it's not like, it doesn't have to be a knee-jerk reaction. It doesn't have to be, you know, in a crisis or like, oh gosh, we need to do this. Yeah, so it's really. And
then we've had those individuals that, you know, the time has come and gone when they've turned 65 and they're in a panic, and you know what, we'll help you through that as well.
Yes, we just would prefer the proactivity, but same thing here. I help people amidst a crisis. It seems like that's more common. We're just hoping to shift that a little bit.
Correct.
So that actually brings me to my next question. So if somebody is already covered under an employer health program, should they also be enrolling in Medicare as well?
The answer could be yes or no.
Okay.
It depends on how rich the employer benefits are.
Okay.
If you have a plan and it's providing great coverage for you on the health side, and you get vision and dental, and more importantly, if it's a high deductible plan and you're contributing to a health savings account, then you do not want to enroll in Medicare Part A or Part B. If you happen to enroll in Part A and you're in a high health savings account and you continue to contribute, there's going to be a penalty for that.
Ooh.
Okay, so it's not humongous, but you will be required to pay a penalty for continuing to contribute to that HSA and being enrolled in Medicare. So if the employer plan is really good, and more importantly, if it's providing benefits for like a spouse or children, okay, enrolling in Medicare may not be a good thing to do, because the Part B has a premium that you're going to pay month after month. And there may not be enough value.
Yeah, if you're getting everything that you need from the employer plan. Okay.
Okay, so it can be a yes or a no. It just depends.
Okay, so somebody, hypothetically, I'm just off the cuff right now. So say somebody waits until maybe they're 68. I don't know. and then they retire, leave their employer, and then they could still apply?
Yes, what happens when that occurs, it's called the special election period.
Okay,
And what'll happen is that you'll make a request from Social Security to add your Medicare at age 68, let's say.
okay,
Okay, and Medicare is going to require that you fill out a form that you take to your HR department that's going to show that you've had credible coverage since age 65, so that you can make this request at a later time and not be hit with a late enrollment penalty or have to wait for the general enrollment period. Okay,
Potentially more.
so you can expedite coming onto Medicare once you separate from your employer, and you have that guarantee.
So glad I asked that question.
Yeah, that's a good one.
What else?
Let's talk about Medicaid.
Okay, we
Okay,
talked about the annual enrollment period already.
now we have it.
Okay,
Okay,
well, let's talk about Medicaid.
Let's talk about Medicaid. A lot of times, even my sister who turned 65 a couple of years ago, she keeps telling me she's on, that her health is through Medicaid. It is not through Medicaid. It is through Medicare. Medicare is the health plan through our federal government for persons 65 and older. Now, you could be a person 65 and older and have both Medicare and Medicaid, but Medicaid is a state program, and it's for those folks that have financial need. So if you have Medicare and Medicaid, it's a beautiful thing, because that means that you're going to have less out-of-pocket costs when it comes to the services that you need on the medical side. Okay, but then there are folks that don't meet those requirements and therefore are only on Medicare with, let's say, a supplement and a drug plan, or they're on a Medicare Advantage plan. Okay, so it's a this or a that. You can't be on both sides of the equation.
Okay,
Okay, so if you feel that you want to know whether or not you qualify for Medicaid, you go to the Family Social Services office in the state that you live in. We're talking about Indiana, and they will take an application and ask you specific questions, and they will make a determination whether or not you qualify for Medicaid. And then if you turn age 65 and become eligible for Medicare, then you would have both.
look at that.
Good thing.
That's a good thing. Thank you for clarifying.
Some of our
that.
seniors need both.
Yeah, totally. I have seen that. And there's actually more and more communities that I'm noticing here, especially in the Indianapolis area, that are accepting Medicaid as their form of payment for even that retirement living, independent living, because there's still that medical need. There's still that maybe oversight or meals or that ADL requirement that's needed.
Okay.
So, and can you tell us the difference between Medicaid and Medicaid waiver? Is that?
I don't know the difference between Medicare and Medicare waiver. That's beyond the scope
Okay.
of my
Okay.
understanding.
Got
Okay.
it.
All I can tell you is that there's different levels of Medicaid. You can be full Medicaid.
Yep.
You can be QMB, QMB plus, Slim B. There's so many
there's
different ones.
multiples.
Okay, so really the offices for Family and Social Services are the ones that are going to take the information and then make a determination as to where you fall in that table.
I gotcha.
And depending on where you fall in that table is going to tell companies like United Healthcare, Anthem, Humana, if you're on an Advantage plan, what additional services and benefits you're going to get added to your plan.
I see. Okay.
Okay, and if you don't have any Medicaid, then you just have a traditional Medicare Advantage plan that is still delivering your medical.
That's the one I hear the most, I
Okay,
feel.
yeah, the Medicare Advantage plan.
Yeah.
Yeah. You know, to be honest with you, I have clients on both sides of the equation. And depending on what your needs are will drive
Sure.
whether or not you're going to be on original Medicare with a supplement and a drug plan, or you're going to be on a Medicare Advantage plan. What I would tell you is that to be on original Medicare Part A and Part B only without having a supplement could be financially devastating. Because Medicare is good insurance, but there are gaps. You have deductibles when you go into the hospital. Let's just use an example. Let's say you were admitted into the hospital and you were there for 3 days. Well, Medicare is going to cover everything on that hospital bill, but $1,400 deductible. So, you know, if you're gonna stay on the original Medicare side, then you either have to be prepared to pay those out of pockets, or it would be wise to pay for a Medigap policy to cover those gaps should you have a need for services under A and B. Okay, under the Advantage side, the reason why that's a better choice if you're going to just have original Medicare A and B only and you can't afford a supplement is because the Advantage plans are more affordable in premium.
Okay.
And they have a limit on your financial exposure for services under A and B. Let me give you an example. I have one of the ladies from my church who's enrolled in a Medicare Advantage plan, and she was diagnosed with breast cancer. And so her husband called me up, you know, really concerned because those therapies can go into the hundreds of thousands of dollars. And I assured him that on the plan she's enrolled in, her maximum exposure for services under A and B in network was $4,900.
Wow.
And he was so relieved.
Yeah, that gave me like a,
Right.
I mean.
So if she had just been on original Medicare Part A and Part B only, doesn't mean that she would have to pay the entire $100,000, but 20% of that could be her responsibility.
Yikes.
Which would be in the 20,000 plus range.
Yeah.
So that is why it's important that you meet with someone that understands this arena and explain to you why, because I get, you know, pushback, but you know, Medicare is what I've been told I should stay on. Well, yeah, that's a wonderful place to be, but there's gaps. And are you prepared? And if you're not prepared, then maybe putting a supplement in place, paying that premium, it's the smart thing to do.
Yeah, just protecting you.
Yeah.
You have to meet with somebody. I can imagine going to the website and trying to figure out all the information I'm learning in this interview. Incredible. You're incredible. Okay, so is there, before we switch, I have kind of some other questions about Storen Financial.
Yeah.
But is there anything before we go on to that about Medicare specifically that we need to cover?
Yeah, the annual enrollment period.
Yes, okay.
Okay, and that's yearly. Medicare allows beneficiaries, those are folks that have that red, white, and blue card, between October 15th and December 7th of each calendar year.
Okay.
You have the ability to evaluate what you currently have in place and make a change or stay where you're at for January 1st of next year.
That's very generous.
Yeah. So it's important if you are currently on a plan, whether it's a prescription plan or a Medicare Advantage plan, to look at the materials that are going to be coming to you in the mail from the private insurance company that's delivering your benefits. That's going to tell you how the plan is going to remain or change for that following year. So it's important that you review those materials because there could be a change there that is going to affect you. It could be maybe a prescription is not going to be covered, or your favorite primary care doctor is not going to be in network. So, you know, don't put them on the coffee table and forget about it. Okay. I've had instances where someone has called me January 30th because they went to the pharmacy only to find out that their prescription is now not covered under their plan. It's a little late.
Yikes.
Okay. So be aware, annual enrollment period between October 15th, December 7th, and we prepare for that. That's a very busy time for us as agents. And we recognize that we're going to be meeting with a lot of individuals.
That was going to be my question. Is if somebody gets this and they're like, this looks like a foreign language, I don't know what any of this means, is that the opportunity to connect with somebody?
Yes.
Yourself or someone like you?
That is correct.
Okay.
You know,
to review it or make sure that like you understand what it's even saying.
Correct. So that's, you know, what I bring to the table is that I make myself available. We're working many, many hours during that period of time.
Like tax season for Medicare specialists.
Exactly. So that we can meet with you virtually. We can do the Zoom thing. We can talk on the phone, or we can meet one-on-one.
To their preferred method.
Right. So whatever you're comfortable with, we make it happen.
Awesome. Cool.
Okay.
Do folks come here?
Yes, at Storen Financial does. Let me tell you a little bit about Storen Financial and how I came about joining their staff. To begin with, I was and have been a Storen Financial client for 10 years, over 10 years. I started coming here to have my taxes done, my husband and I, and we got to meet Greg and Kim and the staff here, and really felt a connection to the way that they deliver business or deliver service to clients. And I'm in the service industry, so I'm real keen about helping. Exactly. And then I would say probably 5 or 6 years ago, Greg and I had a conversation about what I did for a living. And he felt that there was synergy there in regards to, he gets calls, his other advisors get calls from their clients asking, we're coming on to Medicare, what do we do? Okay. And so we decided that we were going to partner together and that I would be their Medicare benefit specialist.
Beautiful.
And that way clients can have a go-to person within the firm that can answer their questions, make recommendations, and if necessary, enroll in the plan. Okay. And so Storen Financial does many things. They do financial planning and investments. That's another area in which my husband and I have taken advantage of their services. We have been very pleased with the advice that we've received, and really feel that having both our taxes and our financial things kind of under one umbrella is a really good fit.
Absolutely. Okay.
And we've been real happy with that. The other things they do, again, is tax planning and preparation. They have a business services segment, and basically if you're self-employed or you have your own business like Christie and I do, they can give you some information on how to be more efficient, how to grow your best business practices. And then of course they added the Medicare benefit advisor to their services. So Storen Financial is an awesome firm, and it is like family. And
I'm very grateful that they allowed us to be here and do this beautiful place.
And so if you're wanting to reach to Storen Financial for any of the things that I've mentioned, their contact number is 317-852-7000. So if it's financial planning, if it's Medicare specialist, that direct number, they'll get you to the right person. The other thing that Storen Financial does, and it kind of ties into this whole Medicare thing, is long-term care insurance. Okay, because that's different. Let me touch on that.
Yes.
So Medicare covers, and Advantage plans cover a long-term care stay if it's for rehabilitation. But if you're at a place where you're no longer able to live independently and you need to move to a long-term care facility, then you either become a self-pay or you have a long-term care policy in place. And there's a gentleman here at Storen Financial. He's the go-to person for long-term care. His name is Alex. I won't even try to pronounce his last name, but if you go to our website, Alex is the person that you can speak with, and he has the information that he can provide to you on putting a long-term care plan in place should you have a need to go into a long-term care facility.
We need to have him on the show.
Yes, I think so. Because again, Medicare is only going to cover a long-term care facility stay for rehabilitation. And so let me give you an example. Let's say you're there, you had a stroke, and that you're rehabbing for that. And typically the way Advantage plans and Medicare looks at it is they're going to be checking with the facility to see how you're coming along.
Progress notes. Are you making progress in this rehab? Is this actually working? Are we?
Correct. And once the determination has been made that maximum rehabilitation has been attained and you want to stay, then you become a self-pay.
And it's expensive. It's not cheap. So, that long-term care, I have seen that play out. The long-term care benefit or the long-term care insurance also helps with home care, home health in your home, wherever you call home. So that benefit is really just a really great thing to have.
Yes.
So yeah, we may have to have him on the show. This is Ruth's first podcast, by the way. She's crushing it. She's doing so great. I'm so thankful you're here. All right. And then if folks want to meet with you, do they just contact the phone number?
Yeah, you could contact the Storen number, which I've given you. I also have a cell number that you can reach me at. It's 317-775-9319.
And I will be sure to put these in the comments, so you don't have to remember them. I will drop them all in here for you so that you can grab them and get connected to Ruth. Is there anything that we're forgetting?
Well, this is really a very high level
Yes.
conversation, and you may have, you know, very specific situations that are happening to you that, you know, don't hesitate to give me a call. We can't cover that all the specific examples in this podcast.
We talked about doing a follow-up episode, taking a deeper dive. So if that's
Correct.
something you're interested in, let
You
us
know,
know.
any questions that you might have, you know, give me a call, send me a text. I'm certainly willing to respond or reach out to you and try to give you the solution that you need for that particular question, or at least let you know where to go to if I can't answer it.
It's my favorite thing about you. You're so wise, such good information. And I also just really appreciate, a lot of this stuff was new to me. So I really appreciate how you deliver this information. It makes me feel good to know that people that are going to connect with you and reach out to you are going to get this information in a way that makes sense,
Yes.
so that they can actually do something and move forward and have the best coverage and protection that they need.
Because, you know, I really try to deliver the information at all different levels, because some of us come with a lot of knowledge and some of us come with not very much.
Yeah.
Okay.
Yeah, if you've never
And so,
navigated it, you wouldn't.
My goal is always to let the client direct the meeting.
Yeah.
You know, I'll ask them, how much do you know? How much don't you know?
Sure.
How can I help you? And at the end of the meeting, have I answered all of your questions?
Perfect.
Okay.
I love that. So a couple things that I want to share with all of you real quick before we go today. Many of you know that Roadmap 2.0 came out earlier last week. So that's available at CAREbyChristie.com. And I talk a little bit about Medicare and Medicaid under Ways to Pay, which is a page here in the roadmap. So check that out if you haven't yet. And then the other thing that I wanted to share is I'm doing a preview party for this roadmap on July 7th at 7 p.m. It will be in this type of format. It'll just be live here on Facebook, so that any of you that are interested or curious as to what lives inside, we will go through all 25 pages again at a real high level view, but just to kind of give you a sneak peek of what's inside. So thank you so much.
Oh, it's been my pleasure.
You being here. It was so fun to see you in person and to do this in real life together. So if you have any questions, feel free to drop them in the comments. We'll get you connected to Ruth, and we'll see you next time.
Have a great night.
Bye.